what are some of the other missed opportunities that you're finding? And when it comes to patient awareness or doctor awareness, is it because when someone is already diagnosed with MS, we're saying like this kind of full screening is not included in the package of diagnosis. Do we think that they had high blood pressure before they were diagnosed? Because I feel like when you're on the way to get diagnosed, when people are whittling down, you probably go through a whole bunch of tests.
Yeah.
So is it that there are no red flags going up for doctors because it's typically uh not as intense, or where's the actual gap?
Yeah, I think because we are in such a great place in treating MS that we've become hyper focused on the treatment of MS. And that's a good place to be. The fact that we have 20 different MS medications and it can take me a full hour to talk through that decision making process and all of the aspects of that care with a new diagnosed MS patient, but it does make us very focused on that, right? And so as a specialty, I think there's room to improve and grow to say, okay, first things first, you came in with weakness or blindness. We had to focus on what's causing this. Okay, it's MS. Like, and obviously, sometimes you're not going to catch every disease that someone has when you're hyper focused on that. And you have a new MS. It's really important to get on treatment as soon as we can. That's important focus and reasonable focus. But then once you get past that step, I think the gap is that we really can take a broader focus on the patient's health, and maybe you know, there's lots of places that are starting comprehensive care visits, which often means having a social worker and a physical therapist, an occupational therapist, a speech therapist, all seeing the patient. But then, as part of those comprehensive care conversations or a part of just a wellness visit, okay, you're on your MS med. Now we want to look at your kind of global health. Screening for these other diseases is probably important. I think in medicine, often it becomes that, well, that's not my specialty, right? I don't know how to treat diabetes. I don't know how to treat hypertension. That should be their primary care doctor. But if patients don't have primary care doctors, are we actually asking, do you have a primary care doctor who's doing the screening at least? Or just because we're not necessarily going to be the ones driving the treatment, should we be playing a role in actually screening patients and then being like, hey, you screened positive for
Mhm.
high blood pressure, possible high blood pressure or diabetes or things like that. Let's make sure I'm going to hand you off directly to a primary care doctor at our institution and make sure that you're getting the care for that you need. I think that's the gap and the really high opportunity for improvement.
Are you finding that patients, when they are diagnosed with hypertension, are they better able to keep the hypertension under control? Is there a difference? Does the hypertension get better? Or are the patients with kind of the worst multiple sclerosis outcome also maybe correlating with n- um, a certain type of adherence to treatment?
Yeah. Um, so my work has not specifically looked at that. So it's in terms of asking me about the research that I presented here at CMSC or our previously published works, it doesn't specifically look at that. But there are groups who have looked at hypertension control and found some different results. So in some large studies, just looking at overall health, they actually did not find necessarily worse hypertension control in MS patients. They found similar results in a recent study. I think it was in the journal MSARD, multiple sclerosis and related disorders. They actually looked at disparities in hypertension control in MS patients, and that study, and I wasn't an author there, and I apologize if I misquote a little bit, but I believe what they found was that Black Americans with MS actually had higher and high blood pressure, MS and high blood pressure, had higher rates of being prescribed a medication, but still had worse control of their medication. And so that could point to either an adherence difficulty, being able to stay on medication, or it could actually just mean that it's harder to control those individuals' high blood pressure, which is something that we've seen in the broader US population. And the exact reasons we don't know, could be epigenetics, could be environmental, right? If you live in an area with higher air pollution and things like that, you might be more likely to have uncontrolled high blood pressure. So there may be environmental factors and things like
Mhm.
that as well.
Yeah.